Hallucination is a complex phenomenon that can lead to intense and often frightening experiences. It refers to a sensory perception occurring in the absence of an external stimulus. In other words, a person may see, hear, feel, or smell something that does not exist in the reality around them. These experiences are real and convincing to the individual experiencing them, making it vital for us to understand their nature and implications. In schizophrenia, one of the primary mental health conditions associated with hallucinations, auditory hallucinations are more prevalent than visual ones. Auditory hallucinations, in particular, are the most common type within this disorder. Patients often report hearing voices that others cannot hear. The characteristics of these auditory hallucinations can be quite varied and complex. One notable feature is when the patient hears two or more voices discussing them. This can manifest as one voice insulting the patient while another voice comments on the situation, providing a continuous stream of commentary about their actions. For instance, one patient might describe the experience by saying that voices are emanating from the walls, constantly telling them they are worthless and suggesting they should harm themselves. Another scenario could involve a patient stating that a man and a woman are having a conversation about their every movement, stating, "Look how he walks, how he eats." This illustrates the distressing nature of the voices, which can feel invasive and overwhelming. Additionally, auditory hallucinations can include voices that interpret the patient's thoughts. The patient may hear a voice saying something like, "He's thinking about going outside now," which can further amplify feelings of paranoia and self-consciousness. Perhaps most concerning are command hallucinations, where voices instruct the patient to perform specific actions. These commands can be harmful and dangerous, urging the patient to harm themselves or others, to break something, or to scream. The experience can lead to significant turmoil and distress, resulting in a struggle to maintain control over one's actions. Derogatory hallucinations also occur, where voices engage in constant insults, mocking, or belittling the patient. They may hear derogatory statements that undermine their self-worth and amplify feelings of despair. They might scream at an imaginary person, shouting, "Stop it! Stop it! Stop talking!" These examples encapsulate the confusion and distress that often accompany auditory hallucinations, revealing how deeply these experiences can affect an individual's mental state and sense of reality. While auditory hallucinations are more common, visual hallucinations can also occur, albeit less frequently. These visual disturbances can be equally frightening and distressing. Patients may see images that others cannot perceive, complex and vivid sights that can lead to panic or fear. The characteristics of visual hallucinations can involve seeing imaginary faces, people, animals, or even strange and unrecognizable creatures. Patients may describe bright lights, unusual objects, or distortions of real faces, perceiving someone's face as that of a demon or another frightening entity. In some cases, they might see symbolic scenes or complex images that hold personal significance. Concrete examples include a patient exclaiming, "A black angel is standing over my bed watching me," reflecting a deeply unsettling experience. Another patient might suddenly scream in terror, insisting that others must see the snakes emerging from the walls. The distress caused by these vivid hallucinations can be overwhelming, and they often lead to increased isolation and anxiety. In a more mundane but alarming situation, a patient might look at their mother and, panicking, shout, "Why are your eyes popping out of their sockets?" This reaction underscores how distorted perceptions can radically alter one's interactions with loved ones in the world. Understanding the difference between hallucinations, delusions, and illusions is critical in addressing these experiences. A hallucination represents a disorder of perception, where an individual sees or hears something that isn't there. In contrast, a delusion constitutes a disorder of thought, characterized by a fixed false belief that persists despite evidence to the contrary. For instance, a person might wrongly believe that a secret organization is following them, illustrating how delusions can lead to a distorted sense of reality. An illusion, on the other hand, involves a real stimulus that is perceived incorrectly, such as mistaking a bush for an animal in the dark. In hallucination, however, there is no external stimulus at all, which creates a significantly different and more profound experience. So, what happens in the brain during these experiences? Scientists have conducted numerous studies to understand the underlying mechanisms that lead to hallucinations. They believe that these experiences stem from abnormal activity in areas of the brain that are responsible for processing speech and vision. For example, during an auditory hallucination, the brain regions typically activated to comprehend external speech may become spontaneously active in the absence of any actual sensory input. The brain misinterprets these internal signals as real voices coming from the external environment, creating a vivid, convincing experience. When addressing hallucinations, treatment strategies typically focus on two main pillars. The first of these is antipsychotic medications. These drugs aim to reduce or even eliminate hallucinations by affecting neurotransmitter systems within the brain, particularly dopamine pathways. This can help alleviate some of the distressing sensations and experiences tied to hallucinations. The second pillar of treatment involves psychotherapy, with a specific emphasis on cognitive behavioral therapy or CBT. This therapeutic approach can assist the patient in recognizing the nature of their hallucinations better. It provides strategies and coping mechanisms to deal with these experiences, allowing them to utilize distraction techniques when hallucinations occur. Furthermore, therapy fosters resilience, encouraging patients to manage their responses to these intrusive voices or images and guiding them on how not to act on dangerous commands they may receive. In summary, visual and auditory hallucinations encountered in schizophrenia represent deeply real and often distressing sensory experiences. They form a core aspect of the suffering faced by many individuals living with this condition. It is crucial to understand these symptoms as a medical sign rather than a moral failing. This perspective not only fosters empathy but also aids in developing effective methods for helping those affected. By recognizing the true nature of hallucinations, we can begin to bridge the gap of understanding and enhance the quality of care for individuals navigating these challenging experiences.